Question 41. When feeding a resident, frequent coughing can be a sign the resident is A. Needs to drink more fluids, B. Having difficulty swallowing, C. Choking, D. Getting full. Answer B. Explanation. If the resident is coughing frequently when eating, report it to the nurse. It could be a sign of a swallowing disorder, dysphagia. Other signs are extra time or effort needed to chew or swallow, food leaking from the mouth or getting stuck in the mouth, and a gurgly voice after eating or drinking. Some residents may lose weight because they can't eat enough. Question 42. Some clients have to be fed at meal times. Which is the correct procedure concerning feeding clients? A. Bring food into the room to feed the client when you're ready to feed them. B. Leave the tray in the client's room and return after all others have been served. C. Ask the kitchen to hold the client's meal for an hour. D. Feed the client quickly and then serve the rest of the clients. Answer A. Explanation. Meals should be pleasant and unhurried for all clients. Food should be served at proper temperatures, so leave the tray in the food cart until you are ready to serve it. Since feeding a client can go slowly, allow sufficient time for the client to eat. Question 43. When giving a bed bath, the last area to be cleaned is the A. Feet, B. Perineum, C. Armpits, D. Eyes. Answer B. Explanation. When giving a bed bath, the perineum is the last area to be washed. After bathing the patient's body, empty the basin and refill with warm water. Place a towel under the patient's hips and buttocks. For females, wash front to back from labia to perineum. For males, wash the penis and scrotum. For both genders, turn the patient on their side to wash the buttocks and anal area. Dry the area well. Question 44. Your client has a fractured hip. The best way to turn is to A. Cross the legs and brawl. B. Check with the nurse for the doctor's orders and restrictions. C. Never use an abduction pillow. D. Roll him toward the affected side. Answer B. Explanation. Always check with a nurse before turning or moving a patient with a fractured hip. Following hip surgery, the client should be positioned to maintain natural alignment of the leg. A pillow or wedge is placed between the legs, keeps the legs in the correct position. Ankles and legs cannot be crossed, and toes should point towards the ceiling. The hip should not be rotated inwards or outwards. The client can never lie on the non-operative side. Question 45. Your patient is on bed rest. You can help prevent development on contractures by A. Positioning in good body alignment, B. Using supportive devices, C. Performing range of motion exercises, D. All of the above. Answer D. Explanation. A contracture is a shortening of muscles, tissues, tendons, and the skin at the joints due to lack of movement and exercise. When joints remain bent over time, they can no longer be straightened. Range of motion exercises provide a way to maintain joint flexibility. In passes ROM. Someone moves the joints with no assistance from the client. In active ROM, the client does the exercises alone or with the help of devices such as a strap. Supportive devices such as spleens, wedges, and bed rolls can maintain alignment and position. Proper body alignment is also important. Question 46. When applying anti-embolism hose (TED), it is important to remember that the A hose should be laundered in bleach. B toe and heel are interchangeable. C hose must be fit snugly without wrinkles. D hose should be very loose fitting. Answer C. Explanation. Compression stockings or anti-embolism hose help prevent blood clots and swelling. Make sure the size is correct for the patient before starting. Assist the patient to lie down in supine position. The patient's feet and legs should be dry. Roll the stocking inside or out the way to the heel. Fit it on the foot and heel, then roll up onto the patient's leg. Smooth any wrinkles and make sure the stockings are straight. Talcum powder can be helpful to prevent friction and rubbing on the skin. Hint, wearing gloves can help you grip the hose better and smooth out the wrinkles. Wrinkles can cause pain and pressure that can damage skin. Question 47. Mr. Hawkins tells you that his hearing aid isn't working properly. The first thing you should do is A. Check if it is turned on. B. Notify the family. C. Insert a new battery. D. Immerse it in water. Answer A. Explanation. When a device, such as a hearing aid, does not seem to be working, begin to checking to see if it is turned on, if the volume is correct, and if the battery is inserted properly. Often the solution is something simple that the patient has overlooked. If it still doesn't work, try a new battery. Finally, tell the nurse. Question 48. A nurse aide can do any of these to help reduce a patient's pain level except A. Giving the patient pain medication. B. Instructing or guided imagery. C. Encourage slow, deep breathing. D. Distracting the patient's attention. Answer A. Explanation. The CNA is not allowed to give any medications but can use other ways to help a patient with pain relief. Non-medication methods have been shown to be effective ways to deal with pain. Distraction by listening to music or watching television can be effective. Breathing and relaxation techniques can be similar to meditation. Guided imagery is useful for visualizing pleasant and positive scenarios. Question 49. Urinary incontinence is a predisposing factor to A. Dehydration syndrome, B. Congestive heart failure, C. Urinary tract infections, D. pressure sores. Answer D. Explanation. Exposure to feces and urine is one of the most common causes for skin irritation and breakdown. Thorough cleaning after a client has had an incontinent episode is important for several reasons. If perineal skin stays wet, it becomes waterlogged and fragile. Urine contains ammonia, a harsh chemical that damages skin. Many clients have dry skin which can develop tiny cracks, allowing bacteria to enter the body. Clean the client, dry the area, and apply a barrier ointment to minimize any future contact by feces and urine. Question 50. To clean a resident's eyeglasses, what should you do? A. Clean the glasses with warm water. B. Allow the eyeglasses to air dry. C. Use liquid soap that contains lotion. D. Dry the lens with an abrasive cloth. Answer A. Explanation. The best way to clean eyeglasses is with warm water and a drop of liquid dish soap on each lens. Don't use soap that contains lotion. Gently rub both sides of each lens, as well as the nosepiece and frame. Rinse with warm water. Dry carefully with a microfiber towel or a soft, clean cloth. Thank you for watching.